Hello, class. My name is Chris Carter. I am a United States Marine veteran. Um, for my project, I picked a topic that has to do with something I struggle with daily, which is PTSD. And my experiment is going to be on how to treat PTSD symptoms with aerobic exercise. So by nature, or by trade, I'm a strength conditioning coach. So I run a gym, and these are kind of the therapies and stuff that I've done on myself to not only have 6 years and 7 months sobriety today, but just things that help lower my PTSD levels. So, first of all, the research questions and abbreviated literature review. The research question is, can we decrease symptoms of PTSD with aerobic exercise? Just adding aerobic exercise into someone's routine should help relieve stress. Exercise in general relieves stress, so I would think that adding a regimented aerobic routine will also help reduce stress. The research that I got was from Hegberg, 2019. Wrote an article on exercise intervention and PTSD, a narrative review and rationale of implementation. Alderman, 2016. MAP training, combining meditation and aerobic exercise, reduces depression and rumination while enhancing synchronized brain activity. Crombie, 2018. Physiological responses and aerobic exercise in individuals with post-traumatic stress disorder. Rosenbaum, where are we at? 2011, exercise augmentation compared to usual care for post-traumatic stress disorder, a randomized controlled trial, the REAP study. Rosenbaum, 2015, physical activity in the treatment of post-traumatic stress disorder, a systematic review of meta-analysis, and Foe, 2016, psychometric properties of post-traumatic stress symptoms scale interview. So my null hypothesis is that aerobic exercise will not have any kind of correlation with reducing stress or reducing symptoms of PTSD. My hypothesis would be that it will reduce the symptoms of PTSD. The study design is going to be a 12-week study, and veterans that are going into the VA that already have a diagnosis with PTSD are going to be referred by their doctor if they are healthy enough to participate in this experiment. I'm looking at 100 veterans, and what they'll do is they will be randomly referred over to me for a 12-week study on PTSD symptom reduction with aerobic exercise. So that's how we're going to do this. Whenever they first get there, they're going to do a VO2 max, so they know to stay in their heart rate, their target heart rate zone. In their VO2 max, that would be conducting 30 minutes of exercise at a 50 to 70% heart rate. For this, whenever they're done with their when they're done with their aerobic exercise, they will do a post test, which is the PSSI 5. In the PSSI 5, it looks at PTSD symptoms. It is 24 questions about stress symptoms that they've had in the last month. What we're going to use for our statistical analysis is going to be a pre and a post test. So after each exercise session, they're going to rate their stress level. And this is a quantitative study. This is also a correlational study. So we're going to determine if exercise can reduce